Treating urethral strictures in Kandy, Sri Lanka. A urethral stricture involves scarring that narrows the tube that carries urine out of your body called urethra. A stricture restricts the flow of urine from the bladder and can cause a variety of medical problems in the urinary tract, including inflammation or infection. Signs and symptoms of urethral stricture. Decreased urine stream. Spraying of the urine stream. Incomplete bladder emptying. Increased urge to urinate or more frequent urination. And difficulty, straining or pain when urinating, blood in the urine or semen. Urinary tract infection. Causes of urethral stricture. Scar tissue, which can narrow the urethra, can be due to a medical procedure that involves inserting an instrument, such as an endoscope, into the urethra. Intermittent or long-term use of a tube or catheter inserted through the urethra to drain the bladder. Trauma or injury to the urethra or pelvis. An enlarged prostate or previous surgery to remove or reduce an enlarged prostate gland. Cancer of the urethra or prostate. Sexually transmitted infections and radiation therapy. Urethral stricture is much more common in males than in females. Often the cause is unknown. Treatment. There are many options depending on the size of the blockage and how much scar tissue is involved. Treatments include dilation, enlarging the stricture with gradual stretching, optical urethrotomy, cutting the stricture with a laser or knife through a scope. There are no available drugs to help treat strictures. Without treatment, you will continue to have problems with voiding. Urinary or testicular infections and stones could develop. Also, there is a risk of urinary retention which could lead to an enlarged bladder and kidney problems. Urethral dilation. This is usually performed in the urology theatre with local anesthesia. The stricture is stretched using larger and larger dilators called sounds. A special balloon on a catheter can also stretch the tissue. But this stretching is not really a cure and needs to be repeated regularly. If the stricture comes back too quickly, you may be taught how to insert a catheter from time to time to prevent it from coming back. Side effects include bleeding and infection. Sometimes a false passage or second urethral channel may form from the stretching. Optical urethrotomy. This uses a special scope that is moved along the urethra until the stricture is found. A knife blade or laser at the end of the cystoscope is used to cut the stricture and create a gap. A catheter may be placed into the urethra to hold the gap open and let it heal. The suggested time to leave a catheter tube draining is based on the length of the stricture. Visit Uroclinic in Kandy, Sri Lanka and find the best treatments for your urinary problems.